Hey there. So today I want to talk about numbing cream and why I don't use it. It is a question I get asked every now and then. How come you don't use numbing cream for procedures like microneedling, PRP or skin boosters, etc.? There's a couple of reasons why. So the numbing creams that we use, benzocaine, xylocaine, tetracaine, prilocaine, they're all the same. They have a very similar effect. They prevent our nerves from sending signals to our brain to say, hey, my skin is feeling uncomfortable. And while that works very well for the patient, they're comfortable throughout the treatment, it lessens the vascular response. So I need to keep visual observations on my patient's skin when I'm working on them in the chair. I need to look for signs of excessive erythema, like extreme redness, and I can't do that if I've applied a numbing cream because it definitely gives kind of a sallow, almost a jaundiced look to the skin. It makes it very difficult for me to monitor what's going on. Number two is pain threshold. So I'll always ask patients when they're in the chair, how are you feeling on a scale of 1 to 10 pain-wise? If they have a numbing cream applied, they might say, oh, I'm feeling fine, like a 1 or a 2, because they can't feel it. Then they go home and the numbing cream wears off and they might feel intense pain because I've gone too deeply on their skin with something like a microneedling pen. Whereas when they're in the chair with me and they don't have the numbing cream on, they might say, I'm a 2 out of 10 or I'm a 3 out of 10. So I know, okay, I can't go any harder with this patient. I'm going to leave it as it is for safety. And then last of all is alcohol. So the products that I mentioned, they all contain a really high percentage of alcohol. So when patients come into this room or rooms all over the country, very similar to this, they're looking for treatments that help to improve hydration. So when we add alcohol to the skin, it dries our skin. Specifically when you're microneedling alcohol into the skin, that alcohol is penetrating at a much deeper level and it's going to dry the skin. So it's doing the opposite of what we're trying to achieve in this room. So while I would like all my patients to be super comfortable in the chair, I am focused on results. People come in here because they're looking for results, and at the end of the day, that is what people pay me for. If you have any questions or you'd like to know more, you can give me a call on 062 88002.